Hello, my name is Stephanie Ling. I'm an NIHR academic clinical lecturer at the University of Manchester, UK, and I have with me Silvia Aguilera, who is one of the chairs of our session that we've just live streamed from child to adult in one day, focusing on intermediate care between young adult and adolescent patients. Sylvia, can you tell us a bit about your role within EULAR?
Yes, of course. So I am part of the PARI committee since last year, and I am also part, I am patient advocate also in the European Reference Network, ERN Reconnect.
Oh, wonderful. So I found that session really inspiring. I don't know about you. And I think there were quite a few different themes to take away for me. So my number one theme was communication. So I don't know what your impressions were about that. If you'd like to tell us a bit about what your feelings are about the communication aspect of the intermediate care.
Yeah, I think we're just starting now to talk about transition, like it's something that is just coming now to the spotlight. So definitely there hasn't been a lot of, information about it, and communication is an essential part of it. But if people don't know about it, you cannot communicate on it. So I think that yes, there needs to be, I think there's different things about communication. So there needs to be communication, we have seen clearly now in the session, between medical clinicians like the pediatricians, the pediatric rheumatologists and the adult rheumatologists, between the caregivers and the patients, but caregivers and the people that help, the healthcare providers that help it with the transition. There's a lot of work to do in the many aspects of the communication in transition, yes.
And I feel like, so one of the other main themes for me was individualization of care. And that was both for the patient, the young adult and adolescent patients, but also with regards to involvement of the parents as well. So what are your feelings on that?
I think we tend to, when we do trials, when we study patients, we tend to put people in groups, and we like to say, these are the recommendations for these groups of people. And I think we cannot do this with transition. Transition, like the speakers have said in the session, can happen earlier for some, can happen later for others. There has to be really an individual approach to transition, and we need to learn that this has to be the case. We cannot just say transition happens from 12 to 16, and when someone is 14, they can go, to talk to the adult rheumatologist, and then the adult rheumatologist will do this, and this. I think we really need to get in the perspective that we need to look at the patient, talk to them, ask them what they do, what are they going to study, what their plans in life are, to see what their relationship with their parents are, to see if they can accompany or not during transition. So I really think that we need to look at it from this perspective.
Absolutely. And leading on from that, what I found really interesting was what was being said about we need to gather more evidence so that we can enable that change. So are you seeing more and more people doing work like in the oral abstract that was presented, so gathering maybe qualitative evidence first so that we can try and influence this positive move? Are you seeing that more?
Yes, definitely. Like I said before, I think transition is just coming now to the spotlight. I think it will gain more and more traction, that more studies will be done. We've seen 2 surveys just now in the session that have been done, one in Latin America, which is super impressive work. I think this is just coming right now, becoming a very good topic, a very important topic, and I think we are going to see very interesting results in the next years regarding transition.
So a really positive ending there, I think. So thank you so much for taking the time to do the interview. Thanks for watching.
Thank you so much.
And please join us for more live streams later.